Blog Talk Radio.
Hi, this is guest host Emily Russell of Russell Health and Wellness and Shaklee Distributor, and today we're talking with Laura Zaranski, who's the clinic director and Chinese medicine practitioner for East Wind Acupuncture. Hi, Laura. Thanks for being with us today.
Thank you, Emily. It's good to be here.
Wonderful. Now, before we sort of delve into Chinese medicine and a bit more about acupuncture, you have a really interesting background in education, including an internship in China. Would you want to tell us a little bit about that?
Yeah, absolutely. I often do get asked how I got into Chinese medicine, and it is kind of a little bit of a convoluted path, but it's one of those paths where you finally get there and look back and realize everything you've ever done led you to that thing, and that's where I am. So I did start out, actually, I started out as an aeronautical engineer, and after about 2 years of doing math every single night, I got really tired of doing mathematics and really needed to change my course of action because it really wasn't my passion anymore, which often happens to us young college students. And I ended up deciding I was really fascinated and interested in health and wellness, and so I went into our pre-med program at Cal Poly San Luis Obispo in California, and I started studying anatomy and physiology. So my background is biological sciences with a concentration in anatomy and physiology. And along that path, I started studying herbs in college. I picked up a book by Michael Tierra, The Way of Herbs, and I started studying that book inside and out, making my own herbal formulas and remedies, breaking them down in coffee grinders and capsuling them to myself, and I realized that these things were extremely effective. I was giving them to friends and family, and they were telling me and giving me results that these things were working very well for them, and that took me onto a path of natural health and realized that I think I really want to do something more in a natural health setting. So I really wanted the most effective. As a scientist myself, I wanted something long-standing, clinically used, scientifically able to prove all of those things that we often look for, and traditional Chinese medicine had the answer to that. So I was able to, after my bachelor's degree, go on to a 4-year program in Chicago, Midwest College of Oriental Medicine. It's the second oldest school in the country, and I was able to do my master's of Oriental Medicine. So I have a master's degree in Chinese medicine, and along that path I was able to go to China. I went to the University of Guangzhou in southern China, where I did a month internship at the traditional Chinese medicine hospital there. And the interesting thing about that experience was the clinic that we have now here in Chesterton and Highland, they're very much like their outpatient clinics in China. We do everything that they do for the patients with normal common ailments, but what I got to learn while I was there is what happens to the inpatient people. So people might have been in there from comas to tuberculosis to heart attacks, and we saw them using Chinese medicine from acupuncture, herbs, dietary recommendations. But one thing I didn't know existed was that they do herbal IV drips. So how they introduce their medicine in people who are in the hospital would be like we would, too, through an IV, except they're using herbs and not pharmaceuticals. So that's where I ended up, and now I've been in practice for over 15 years.
Oh, wow, that is a fascinating background. And so like you said, there's 2 clinics, one in Chesterton, correct, and then Highland is your other location?
Correct, yes. And we have a small satellite clinic in New Buffalo, too, New Buffalo, Michigan. Okay,
wonderful. And so when you talk about these outpatient sort of treatments, let's just talk a bit for people who aren't familiar with Chinese medicine. What is traditional Chinese medicine, and are you a doctor? How is it different from that?
Traditional Chinese medicine is a whole medical practice that relies on, they have their own theory of health and wellness and balance, of energy and physical causes too. So biochemistry in China is the same as biochemistry in the United States. The biggest difference between Eastern and Western is that we recognize an energy system, not just a physical system. And then, of course, how we treat. So traditional Chinese medicine incorporates a whole medical study, and that's why it takes 4 years to go through school, with pathology, diagnosis, and treatments. And then the treatments, people often think of acupuncture as the treatment, but that's just one of 8 different ways of treating the body that we learn. Okay,
oh, wow.
So within traditional Chinese medicine, we do learn acupuncture and moxibustion, which is a warming therapy. And if anybody's interested in learning more about these, of course, you can Google them, or you can even check out our website at ewacupuncture.com, and it defines these words. But if we looked at the character for acupuncture, it literally means warming needle. And that is because they've used this warming technique called moxibustion for as long as or longer than they've used acupuncture needles. So acupuncture and moxibustion are one of the main treatment therapies we have, but we also do a year's worth of massage therapy. We also do a huge study in herbalism, so we have a very strong background in herbs, probably more than any other field. Even Western herbalism doesn't have the extensive knowledge that Chinese herbalism has. We also look at diet and how diet can affect our health. We look at exercise and movement, not just cardiovascular, but we also look at cultivation of energy in forms of Tai Chi and Qigong and yoga, things that don't expend our energy but actually create more energy for us. And we also look at meditation, and that's the ability to learn to be calm and relaxed. We practice being active every day, but nobody ever helps us to learn how to be calm. So meditation is the practice in being calm and down, relaxed. And then 2 other areas of study that we don't use very clinically but are part of our medical system as well is feng shui and astrology, and that has to do with the study of energy through time and space. So traditional Chinese medicine is a huge area of study from all of these things we just talked about, diagnosis, theory, treatment, and we are not considered doctors in the United States. We don't go through a medical training here. You have to go through a medical school to do that. We have as much training as a medical doctor would be in China, but in the United States they are starting a PhD program now for Chinese medicine practitioners, which would come out with a doctoral degree, just like any PhD program. It's an area of focus study, so you might study gynecology or fertility or geriatrics or even infectious disease.
Right, but if you were in China, the doctors that practice there in the hospitals would have your training.
Absolutely.
Yeah.
All of it.
Okay.
Yeah, every single last bit. So we would be considered doctors in China, but not in the United States. Yeah,
okay.
That's correct.
So when you talk about this, and so you sort of went over basically the 8 kind of facets, right, that Chinese medicine uses, it seems like such a more holistic approach to someone's health. You're sort of fighting chronic or acute conditions in many different angles. So would you say that is one of the main differences between Eastern and Western medicine?
Definitely in the way we treat, absolutely, because the only other treatment options with Western medicine are pharmaceutical medications, surgery, and physical therapy. I mean, those are really the basic 3 treatment strategies with Western medicine. So, of course, we are able to incorporate a huge variety of treatment strategies based on the patient's condition. But the real biggest difference is that Western medicine is a quantifiably based medicine. And that means you have to show up on a test or exam or an X-ray, okay? But most people aren't there yet because we start with energy. We are an energetic being as well as a physical being, and when our body starts to break down, it generally starts in energy problems. And those are unquantifiable, so therefore in Western medicine we kind of sort of ignore that whole part of our physical and energetic person. And that's where we start having problems. And for somebody to show up with say, kidney failure, you have to have about an 80% loss of function in your kidneys before you trigger the test. Okay?
Wow.
What happened to the first 80% loss? You aren't asymptomatic. You have problems. Okay? But the Western medicine wouldn't say that that's a kidney problem. We would just say that you have back pain or fertility issues or urination frequency. There's a whole host of problems that can happen when that system goes downhill energetically, okay? And it can lead to real physical problems, but it's not quantifiable yet. And that's where the biggest difference lies, is that Chinese medicine studied energy.
Yeah.
Okay?
And often that diagnosis comes too late.
Our study, we do, what's that?
It seems like that diagnosis with Western medicine often, unfortunately, comes too late when that problem's been going on for such a long time.
It often does. You're right. It often comes too late. It's either that the body now is broken down too far or it's just become a more advanced problem, because obviously if you trigger an organ test problem, you're starting to have some serious problems, right?
Right.
Before that, you're just feeling poorly, you're having some symptoms, but eventually it could lead to even chronic and deeper-rooted real biochemical and physical problems, which obviously could be life-threatening at that point. So we study energy. That's one of the differences, and of course the way we treat. But the similarities are anatomy, physiology, biochemistry, and in China and even in the U.S. we would look at tests and exams, X-rays. These are all physical clues that help us to learn more about the human body. In most states, we are not considered primary care physicians, but California, Wisconsin, Florida, and New York, Chinese medicine practitioners are considered a general practitioner and could order lab tests and X-rays and things like that, or refer to a specialist. In the state of Indiana, that is not the case. We are not considered primary care physicians. So most of our clients are working with their medical doctors for their tests and exams, and we're doing our diagnostics, and we use that information that they gathered from their Western doctor.
Okay. And now, for those of us just joining in today, we're talking with Laura Zaranski of East Wind Acupuncture, and we're talking a lot about Chinese medicine and some of the differences between Eastern and Western medicine. And now that we've started to talk about these different conditions, can you talk a bit about what can be treated with traditional Chinese medicine?
Well, Emily, theoretically anything, okay? Really because, and I say that because really theoretically we could treat anything. Chinese medicine is not geared towards treating a disease. It's geared towards treating the physical body. It's trying to make your body work as optimally as possible, okay? So what do you need to do that? You have to have three basic things. You have to have a normal nervous system. Everything has to fire correctly. You have to communicate within the systems correctly. You have to have good blood circulation. Your blood has to get to every part of your body to function normally. And you have to have strong organs, okay? So what we look at is the blood moving correctly? Are the nerves firing correctly? And are the organs working correctly? If they're not, we're going to encourage them to go back to normal functions. Okay, so if we can encourage your body to be at its highest healing potential, your body will repair and regenerate and renew itself faster than it declines. But if there's a break in that thing at all, the body may have a hard time healing itself. Okay, so for instance, a diabetic has a hard time, healing wounds. They actually have, organ problems, and their body does not have good circulation to the foot, let's say. So their wound, they could have an open wound for a year. But in a healthy, normal person, that wound should go away within about a week, right?
Right.
Yeah, so theoretically we can treat almost anything, but in cases of advanced breakdown of the human body, like in cases of cancer or Parkinson's or MS and multiple sclerosis, we're talking about a body that's gone way downhill. And the potential to encourage their body to go back to normal function could be inhibited by these things, and it may be impossible or very, very slow. My average patient, we can treat, all kinds of conditions, from internal problems, which is 60% of our practice is internal medicine, from asthma and allergies to digestive problems like IBS and GERD, or even, constipation, diarrhea. We go into a lot of female issues, from fertility, irregular cycles, no periods, menopause, all the way out to, of course, every kind of pain condition you could think of, from back pain, joint pain, fibromyalgia, headaches, and so forth. And that's about 40% of our practice.
And that's so wonderful. I think a lot of people, when you name these things like allergy and asthma and fertility, so many people don't realize that this approach, like Chinese medicine, really has wonderful answers and treatments for people, besides just taking a pill that might not help or might have side effects that make you worse off.
Right, that's correct. And the thing is that we often forget our body's own healing potential. So when I give a talk, a lot of times I'll even ask my group, has anybody here broken a bone? Emily, have you broken a bone?
No, I have not.
No. Has anybody you known broken a bone?
Yes. Yeah.
Okay. So we get a cast on that thing, right? Well, the cast is there to help keep our bone in place, but it's our body that actually does the repair, not the cast, right? So we often really fundamentally forget that our body is designed to repair itself if it has nerve communication, blood circulation, and organ strength. And that's where Chinese medicine comes about this. It's a different approach. We aren't trying to just suppress a symptom. We're trying to encourage your body to take care of its own symptom. Just like when you were young, you didn't have that back pain even though you fell off your tricycle 500 times, okay? Because your body was able to keep up on it, right? But then when you get to be, 45 and your body's energy has declined, it says, I can't keep fixing that area over there anymore. It's taking a lot of energy, and I need to just go into survival mode, and that's taking care of the organs now. So let's forget about the musculoskeletal problem or the, endocrine problem, these non-important things for survival. They're important, don't get me wrong, but I mean, like, not as important as keeping your kidney intact or your heart. Right? So eventually your body's got to decide, should I keep fixing this thing over here or should I actually go and make sure you stay alive? And your body will always pick survival. So acupuncture encourages that to go back to normal, tries to encourage normal health functions. And even, you brought up allergies. It's kind of interesting because people say, well, if I didn't live in an area with all these allergens, well, how many people live in this area who don't have allergens? Why is that? That's because their body is strong enough to resist the allergen. The allergens are always there. So somebody who's got allergic reactions to things in the air have a lot to do with weak lung fields, okay? You strengthen that system, you become more resilient to this thing, and you don't have it affect you anymore. It's not the allergen that caused the problem. It's your body's imbalance. We strengthen that. Does that make sense?
Absolutely. And when you talk about this, like strengthening the body and bringing the energy back into balance and having your energy basically optimized, acupuncture is one of the ways you can do that. And I think a lot of people have some misconceptions about acupuncture or don't really know much about it, think, they're going to stick needles in me, what's going on? Can you talk a little bit about that, the misconceptions that kind of go around acupuncture? Yeah.
Yeah, absolutely. And, truthfully, it's really what fascinates me about traditional Chinese medicine is that you stick a needle in your body and something gets better. I mean, how bizarre is that? That's bizarre, right? It seems impractical, or how does that work? Well, first of all, the biggest misconception is that people think it's very painful, and that is definitely not the case. You will feel something. We are actually sticking a very tiny needle, and our needles are 0.25 millimeters around. That's 5 times smaller than the average hypodermic needle. And hypodermic needles are meant to put something in your body like a chemical or draw out your blood. So it's got to create a hole, right? So that kind of hurts. Those can be very painful. But acupuncture needles are designed to part through cells and cause very little tissue trauma, and it only stimulates the sensory nerve. So once the sensory nerve felt that puncture, you don't keep having a pain response. Some of them you feel go in, some you don't at all. But once those needles are in, you don't have continued pain. So it isn't a very painful experience, but it's definitely not without sensation. And a lot of people, once they have the needles in, actually fall asleep. It's extremely relaxing to the body, and people will often even fall asleep. So that's a huge misconception that it's painful. The other misconception is that it doesn't work. And the real reasons it doesn't work is it's either they didn't give it enough time or the body is really declined to a point of no return. We have thousands of years of research in Chinese medicine, but not in the United States. We didn't even have relationships with China till the 1970s. So we are just now getting open to the possibility of looking at all of their research and clinical data. And then the other thing we have to do is translate it, right? I mean, it's all in Chinese. So we have to have translators who can bring that there. And that's why it's been slow to come here. But it's definitely not without research or clinical study, trials, and also, real quantifiable outcomes. And this is another misconception because people say, my doctor said it doesn't do. It does do something, okay? Now, I will explain a little bit about acupuncture very quickly and how it works. When you puncture the skin, your body does recognize that through a nerve command, and it sends a signal back to the brain that you've been punctured. Your body knows you've been punctured, and that's starting to stimulate your nerves. Okay, and different chemicals are released by acupuncture, and one of the things that we're finding out through MRIs is that different points stimulate different parts of the brain. So there's different commands that happen with Chinese medicine and acupuncture and your points. The next thing that happens is it starts circulating blood to those areas that have been punctured. Your body wants to shore up that hole, which we already established is very little hole, but your body's still saying foreign object in the body. Let's get blood there to help fight infection, to help with inflammation and pain, and start helping the healing processes. It improves your immune system, and so those are two areas that acupuncture works on. And then we look at herbs, and that helps to strengthen the organs, and that combination is going to get to that triangle we just talked about between proper nerves, proper blood flow, and strong organs to create a healthy body.
Mm-hmm.
Okay, a healthy body resists injury, illness, and disease and manages its symptoms within a few days or a few weeks. If it's a broken bone, they don't linger. You don't continually have symptoms every month for the next 10 years. That's a broken down body.
Right,
okay?
right.
So those are some of the biggest misconceptions about our practice.
And so when you're using the acupuncture technique and where you're putting the needles, some people think it's random, but you're working on an age-old energy system, and they're getting put in very particular points, correct?
That's absolutely correct, and it does make a difference. Now, any acupuncture needle put into the body will have an effect on the body in those ways I just mentioned, okay? But knowing the points and the point selection and the diagnosis of why you might pick a point over another point that's going to make the difference between a good practitioner and a great practitioner. Okay?
Yeah.
So in the state of Indiana, medical doctors don't have to go to acupuncture school at all, Chinese medicine school at all, to stick needles in you. But if they didn't learn the whole medical system, they're only limiting themselves to what we call medical acupuncture, and that's just, this is a common point prescription for back pain. Would it be effective? Sure. But could it get maybe the same results that we can? And the same results that we can have is potential reversal of function for years and years and years. Okay? If you strengthen the system that's in balance, then you're actually able to make that symptom stay away for years, not just months. And you don't have to just manage your pain. So that's one of the things that will make a good practitioner and a great practitioner, and why you would see a master of science in Oriental medicine versus just a licensed acupuncturist. Chiropractors only need 200 hours in the state of Indiana to practice acupuncture. Again, not the whole medical system, because they don't learn, what is kidney insufficiency or what is liver blood stagnation. If they don't know what that is, they're not going to be able to pick the best points on your body or use all the other modalities that we use to heal the body.
Right, and I think that's such an important distinction that you mentioned, because someone may have had an experience maybe with acupuncture or really any form of alternative medicine and maybe not had a good result, but they need to think about, people's training, and there's a big difference between practitioners. That's a very good point you bring up, I think.
Yeah, huge difference, absolutely.
Yeah.
And it's, they've just started letting, I think, physical therapists do what they call dry needling, and they're going to school for a limited weekend. We have 3,000 hours of training and 1,000 clinical hours before we graduate, and these guys have a weekend course, and they're sticking needles in the body. Again, could it be effective? Absolutely. It could have an effect. Any needle stuck into your body is going to affect you to some degree, but to what degree is the difference, right?
Right. Well, for those of us just joining, we're talking to Laura Zaranski today of East Wind Acupuncture. She's the clinic director and Chinese medicine practitioner there. And now we've talked a bit about acupuncture. One of the other things you've mentioned a lot is herbs. It's such an integral part to Chinese medicine. Can you talk a bit? I think people also have some misconceptions about herbs and how they work, and there's been some stuff in the news sometimes about, don't take the herbs, they might be contaminated. And tell us a bit about that and how how they work and the safety behind them at your clinic.
Well, that's a great question, and the truth is that we really are undereducated in herbalism too, and so the difference between taking echinacea for a cold is really knowing why you should not take that. Echinacea is a cold herb, and if you give that herb to treat a cold condition with a person who's got what we would call like a cold, like they're shivering more, they have thinner, clear fluids, then you could actually exacerbate their problem. Echinacea would be more indicated for what I would call a heat cold, okay, which means that person has more of a fever and maybe yellow, thicker fluids. Okay, so knowing the difference between why you shouldn't take an herb comes from training, and that's a critical component to understanding effectiveness of herbs. And then within our clinic, there is. You don't know the quality of the herbs that you're getting. So we only stay with companies that actually do their own testing. So if they're coming in from out of the States, which the company I work for or we get our herbs with, they do import their herbs. But then they batch test everything here in the U.S. for contaminations of metals, pesticides, herbs, anything else that we would consider to be not and should not be into that formula. So I know that the company I am using has as tests to make sure that those are pure, straight-up herbs and nothing else in them. Okay? So that's one thing we really do want to watch, because you don't know the purity if it's getting random. But the other thing is, a lot of people say, well, herbs don't really work. Well, that's either because maybe they don't have the right dose or the right herb. And if you believe in nutrition, right, is our basic fundamental building blocks our body needs for normal functions, to be able to build proteins, to be able to break down carbs for energy and run our cells, we need our food. So food has what I consider a neutral action. It doesn't necessarily force a functional change, but it's what we need every day. Herbs are the next step up. They're more chemically involved, and they are going to force some change, and they're going to make some impact on what happens biochemically in your body. And then drugs take it to the next level. They got even stronger and more intense, and they have a stronger and faster reaction biochemically in the body. So I've had people say, oh, well, you know what, I don't believe in herbs, but they're taking drugs. If they believe in drugs, then they need to be able to believe in herbs, because it used to be about 75% of our drugs came from an herb base. We didn't just make these chemicals up. We study them through what we found in nature. And so a lot of, like aspirin came from white willow bark, okay?
Right.
And they realized that salicylic acid is what has an impact analgesically, so they took it out, extracted it, and turned it into aspirin. Now, that makes that action stronger and faster than it did in the original herb, but then it comes with side effects like, bleeding in the gut, which white willow bark won't do.
Right. And now
there's
that's
a lot
a
of
good point. As well, I was going to say, because a lot of pharmaceuticals, for example, say that someone might take for diabetes or other conditions, and usually people are sort of resigned to, okay, this is what I'm going to take, and there's no discussion of ever getting off that med or, coming off of it at some point. Now, herbs are very different, correct? You're using them to get the body back in balance. Would it be something you take for a long period of time, or how would that work?
Chronic conditions do take longer. I mean, there are people who need to really restore their function. It could take them 3 years to have to take an herb formula. Some people in acute conditions like a cold or flu, it's going to be a few days, all right? But the average person doesn't need to take herbs, longer than when they restore balance. Once you've restored balance, let's say you kept taking the same thing, you could throw your body over to the other side. Of that balance now, right? So either you need to go to something more neutral and less active within the body, or you just go to food therapy at that point and just eat better, because now you're at a state of balance. It's going to be easier to maintain your balance through nutrition.
Okay, wonderful. Now we've talked about herbs and acupuncture, and we have a little bit of time left. What other practices that do you offer at East Wind besides acupuncture, just so people are aware of all the various things that you offer at your clinic?
Well, we offer every single aspect of the traditional care that I talked about. So acupuncture, herbs, massage therapy, dietary, lifestyle processes, which we opened East Wind Studios to deal with yoga, tai chi, and meditation. Okay. So we have another facility to teach what I call the lifestyle parts of Chinese medicine, but we have extremely well-trained therapeutic massage therapists in our clinic, and people can come into our clinics just for body work. We also do health restoration classes and fitness classes from weight loss, smoking cessation, and things like that. And I'm trying to think. I think there's something else I'm missing. But we offer things like cupping and gua sha that are also physical and manual tools we use for healing the body. Again, you could learn more about those on our website or Googling that stuff. But we offer a wide variety of things here, and people can come to us just for herbal consultations.
Okay, it's so wonderful. And you mentioned your East Wind Studio, and I just wanted to mention that on every Tuesday, there are free workshops there at 6:30 in the evening, and the ones you have coming up in January on the 8th, so it's the second Tuesday, is a free meditation workshop. On the 15th is a free acupressure workshop. The 22nd of January is a free Tai Chi workshop, and the last Tuesday of the month, the 29th, is about nutrition, eating in accordance with the season. So you have a lot of stuff going on in that studio as well.
We do, and we really wanted to be able to provide the community with free opportunities to stay and learn to be healthy. This is what our purpose is about, is getting people as healthy as possible through as natural of means as possible. I mean, this is what drives our focus every single day in our practice and in our commitment to the community. So we wanted to be able to provide free opportunities as well as ongoing classes and workshops and treatments to the general population as well. So if anybody hasn't checked that out, I definitely encourage it. It's wonderful information that you're going to learn there with wonderful people, and you can find out more at our website at ewstudios.com, and that's got an S at the end, studios.
Well, thank you so much, Laura, for being with us today. Again, this is Laura Zaranski of East Wind Acupuncture, and I'm Emily Russell. Thank you so much. It's been really fascinating.
Thank you, Emily. I appreciate it very much.